Today, I'm going to be going over the top 4 common recommendations that you're being given to reverse your diabetes that isn't helping you reverse your diabetes at all. So let's dive right into this because I get asked so often from so many individuals of what needs to be done to fully reverse their diabetes. But the reality is most of you are just managing your diabetes and not doing the right steps to actually fix it. So what is the first common one that we hear? The first common one we hear is if I just lose weight. My doctor's telling me if I lose 20 pounds, 30 pounds, 40 pounds, that it's going to reverse my diabetes and everything's going to be fixed. Well, I'm here to tell you that's likely not going to be the case. Now, if you lose some weight, is that going to be beneficial? 1000% it will. You're going to help take off some pressure off your organs, off your joints. You're going to feel better. You're going to have better energy. You likely may lower some sugars. And over time, you may even be able to lower some of your medications. But is it going to reverse your diabetes? Unfortunately, I'm here to tell you it's not going to reverse your diabetes. So weight loss can be beneficial for your overall health, but if you're doing it for the benefit of trying to reverse your diabetes, you're going to be sorely mistaken, sorely upset. You know, if weight was really the cause of diabetes, then why would we see individuals who are very, very skinny still fully diabetic? And then on the flip side, we see individuals who are totally obese and they're not diabetic at all. So I'm not saying that weight isn't a benefit and it will likely help you lower sugars and maybe you may be able to get off some of your medications, but is it going to fully reverse your diabetes? Unfortunately, that's not going to be the case. What is number 2? Number 2 common one we hear is, well, if I exercise more, I just need to exercise more. I got to do more cardiovasculars. I got to lift more weights. And for sure, exercise is a very good benefit for the body. Building muscle is very beneficial. It's great for your joints and your bone structure as well and keeping you upright and for longevity. Exercise is great for the cardiovascular system. It's great for, lung capacity. Oxygenation is really great for the body. So exercise in general is very healthy. But if you're using exercise for the benefit of trying to reverse your diabetes by itself, it's not going to help you. Now, it will help you lower sugars. If you eat food and you go exercise afterwards, you're going to burn calories, which is going to help you lower sugars. You'll see lower blood sugars overall if you're exercising on a regular basis, and that's really helpful. But is it going to help you reverse your diabetes? No, it's not going to help you reverse diabetes. It will help you manage your diabetes. It will help lower sugars. These things are beneficial, but they're not going to help you reverse your diabetes. What is number 3? The number 3 common one is pharmaceutical drugs. Now, it's important to understand that there are many pharmaceutical drugs. Some states, there's upwards of 450 different medications to help lower sugars. And those all have benefits. I'm not saying they don't have benefits, but are they going to reverse your diabetes? No. Remember, the purpose of these medications is to manage your sugars. I mean, how often do we hear about individuals taking a pharmaceutical drug for a period of time and they're no longer on it anymore? It's very rare. What typically happens is you're taking more medication, you're increasing medications as you're getting worse over time. Remember, diabetes is considered a progressive disease process. And what does that mean? Progressive means it's going to get worse. Things will progress over time no matter what you do because the focus in most traditional models is not focused on the right area. If you want to learn more about what we do in our practice and how we help individuals reverse type 2 diabetes, make sure you download our guide. Click the link below, download our guide. You're going to get a lot of great information and you can go a little deeper into what we do if you want to learn more of this beyond this video. So make sure, click that link. I think that guide will be very beneficial for you. Don't miss out on that. It's a great opportunity to learn more of the specifics that you need to do above and beyond what we've been talking about here today. So at this point, we've identified 3 common recommendations that are not going to help you reverse your diabetes. And don't worry, I'm going to give you the reason why here in a minute. But the first one was loss of weight. Now, loss of weight will help lower sugars, but it will not help you reverse your diabetes. The second one we talked about was exercise. Again, a very beneficial recommendation, but is it going to help you reverse diabetes? No, it's going to help you lower sugars, maybe manage things. And the same thing with pharmaceutical drugs. The purpose of those medications are to lower sugars. That's the purpose because they're called blood sugar lowering medications and they do a really good job until your diabetes progresses. The other one we want to talk about, a very common one, is if you just change your diet. If you eat a high protein diet, high fat diet, ketogenic diet, low carb, etc., all these types of diet fads out there, there's tons of them. Will this help you reverse your diabetes? No. Will it help you lower your sugars? Yes. And this is the key component that I really want you to understand because everything that I've just mentioned, changing your diet, exercising, losing weight, and taking medications, they all focus on what? Lowering sugars. Now, here's the key. If your goal is to lower sugars, then follow those recommendations because it'll be really great for you. But if your goal is to reverse type 2 diabetes, then unfortunately, those recommendations are not going to help you, and you're going to continue to struggle, and you're going to continue to progress with your diabetic condition. Now, you might be confused saying, well, what's the difference? I thought elevated sugars, if I lower them, that is reversing my diabetes. No, that's not the case. Because remember, elevated sugars is a symptom or a byproduct of your diabetes. It's not the cause. This is the reason why those recommendations alone don't work. Of course, I've said this before, they will help you lower your sugars, but unfortunately, they're not going to fix the problem, which is really a deeper cellular disease process. And once you truly understand what that means, you now are in the right steps to start in the process of reversing your type 2 diabetes. Now, the question is this: what is actually causing your cellular disease? And once you identify the cause of your cellular disease, that's how you win this game. You see, unfortunately, for most people, they believe the game is about lowering sugars. And again, I'm going to say this again, I believe lowering sugars is important and you should be doing that. But again, it depends on what your goal is. If your goal is to lower sugars, follow the recommendations. Change your diet, exercise, lose weight, take medication. That will help and do a good job. But if your goal is to actually reverse your diabetes, essentially get to a place where you're no longer diabetic and no longer needing medications, and you can go back to living a somewhat normal lifestyle, if you will, then you have to identify what the cause of your cellular disease is. And if you are interested in learning more about what that cause might be for you, make sure you watch this next video because I go into depth specifically how we identify the specific causes for the individuals that we work with. And make sure you like our page and come back for more information because we're always here for you. We'll talk soon. Take care.